from the very beginning, I have been venting about this equity issue. And the way I see it right now is the almost immediate movement to a booster shot in developed countries is going to further widen the chasm between availability and access for developing countries.
That was Dr. Leslie Ramsammy in a recent sideline interview with this newscast, sharing his views on the pending rollout of COVID-19 vaccine booster shots expected to commence in the United States as early as next month. A report released on Wednesday in the New York Times revealed that the Biden administration is strongly recommending booster shots for Americans who received the Pfizer and Moderna coronavirus vaccines 8 months after receiving their second doses starting September 20. It was said while the vaccines continue to protect against severe disease and hospitalization, new data shows that vaccine efficacy against infection and mild disease wanes over time. Dr. Ramsammy, though in favor of the booster shots for the COVID-19 vaccines, has expressed concerns with the possible ripple effects such a move will have on a developing country such as Guyana that has been on the struggling end with regards to acquisition of the COVID-19 vaccine. Guyana, though fortunate to have more than 59% of its adult population receiving a first dose of the vaccine, is still lagging in its vaccination drive, and the introduction of a booster shot will further complicate matters, Dr. Ramsammy said.
That this will further create inequities because some countries are moving to booster shots, whilst most countries in the world have not yet had a meaningful percentage of vaccination. And therefore, as the more fortunate countries begin to talk about moving to booster shot, it means that vaccination for people in developing countries are being deferred further.
It was expressed that this foreseen inequitable distribution of the COVID-19 booster shots will need to be addressed as soon as possible.
Go to their booster shot, but it shouldn't be at the expense of people living in developing countries. The argument, however, is that it was developed in their countries, they've paid for it, and they should have first access. But vaccines are public good.
Meanwhile, the World Health Organization on Wednesday condemned the rush by wealthy countries to provide COVID vaccine booster shots, while millions around the world have yet to receive a single dose. WHO experts insisted that there was not enough scientific evidence that boosters were needed and said providing them while so many were still waiting to be immunized was immoral. But this is not the first plea made by the WHO, since similar calls were made to Israel, Germany, and France. However, these calls were disregarded. Reporting for the HGP Nightly News, Kendell Richmond.